Infertility is a very common problem, and usually we consider a couple as having infertility if they did not achieve a pregnancy after 1 year of unprotected intercourse. Of course, this definition is also age-related and age-dependent. Older patients that are older than 37 years of age, we will consider them infertile if they did not achieve a pregnancy within 6 months. Once a couple has been diagnosed with infertility, we have to identify the causes of this problem, and these can be related to the female partner, the male partner, or both of them. We start our investigation with the examination of the sperm of the male partner because we want to make sure that we are dealing either with a normal sperm or, if it is abnormal, to investigate further and find out what causes this infertility, this abnormal sperm, and if those causes are reversible with treatment, or if they are not, then we have to do appropriate planning. With the female, we investigate ovulatory function to see whether or not she ovulates. We also investigate to find out whether or not this ovulation is normal or abnormal. For example, a woman can ovulate every month, but she can have a short luteal phase, which will reduce the chances of her conceiving as well as increase the spontaneous abortion rate. We investigate for patency of the fallopian tubes and for the normalcy of the uterus, whether or not the uterus has a normal shape or if there are congenital abnormalities. We investigate to see whether or not the patient has leiomyomata or any other congenital conditions of the uterus, such as uterine septum. Day 3 hormone testing is a very important aspect of our investigation of infertility because it gives us the opportunity to understand how the patient's ovary function, whether or not the ovarian reserve is normal, whether or not these ovaries can produce healthy fertilizable eggs in order to achieve a pregnancy. We investigate the ovarian reserve of the patient. We want to know whether or not the patient's ovaries produce enough follicles and whether or not the ovaries have the capability to produce eggs of a sufficient quality. To accomplish that, we measure the number of follicles that an ovary contains early in the cycle, which we call it the follicular ovarian content, and we do that using transvaginal sonography, and we measure the hormones FSH and estradiol the 3rd day of the cycle. Many times the infertility is secondary to problems with the fallopian tubes due to either previous infections and inflammatory pelvic disease or due to endometriosis. Endometriosis is a very common problem in couples with infertility, and we are very sensitive to the possibility that a patient might have endometriosis, and for that reason we place special emphasis in the early diagnosis and treatment of endometriosis in order to achieve the desired results of conception of a baby.